I'm Adam Rice. I'm the owner and president of Spartan Pharmacy in Pittsburgh, Pennsylvania. This is a great day for pharmacy. This is one of the first times that pharmacists have actually gotten a voice in Washington.
If you come to see a pharmacist, they want to do something that helps you with your therapy. They want to improve your quality of life.
This morning, the committee is going to be looking at one of the most confounding, gnarled riddles in American healthcare today. Pharmaceutical benefit managers are among the most profitable companies in America. What these pharmaceutical benefit managers actually do to rake in all of these profits is a mystery. The deals they strike with drug makers and insurers are a mystery. How much they're pocketing out of the rebates they negotiate is a mystery. With Americans learning about schemes like spread pricing in Medicaid, whether pharmaceutical benefit managers bring any real value to taxpayers is a mystery.
Kelly Selby, a community pharmacist and pharmacy owner in North Texas, has told me about the problems the gag clauses cause at his own pharmacy.
DRR fees have become a catch-all category for pharmacy benefit managers to collect more overhead after a prescription is sold. Pharmacies are often unaware of what they will owe, and the standards for these fees can actually be impossible to meet. As a result, many independent pharmacies in my district are forced to provide the drugs at below cost.
Last fall, the Trump administration put out a report on choice and competition in American healthcare, which highlighted a number of policies from the federal government on down to the local level that impede the supply of high-quality, low-cost healthcare. This includes restrictions that prevent health professionals, including pharmacists, from practicing to the top of their licenses. We're supportive of states examining these restrictions on scope of practice and thinking hard about how to ensure Americans have the best access they can to the health care that they need. And there's no better place to start than by asking more of the most accessible healthcare professionals in America, our community pharmacists.
A lot of local community pharmacists, standalone operations that they're the only one there. And so as we talk about the value chain, Madam Chairman, for me, a lot of times in my debate on how this focuses is on that local community pharmacist because some of this pricing mechanism really hurts these individual pharmacists. And so I've made statements to the like, and I understand the big picture, but when you have a county that only has 5,000 people in it, you know, we have to make sure that they still have the same access to life-saving drugs as anyone else does.
It is just amazing to me that we will continue to turn an eye and not have the discussion. If we wanted to lower drug costs in this country right now, start with the PBMs. Start right where they're at. I've been talking about this for 6 years. I just laid it out. They're going full throttle trying to kill independent pharmacists and pharmacies in our communities. They offer little more than anecdotal evidence of saving money. In fact, when others have actually, states such as Texas and companies such as Caterpillar and others have actually went away from their PBM system, they saved money.
we want to hear from local businesses and local voters, and our community pharmacists are both. So you have a kind of credibility that the big companies lack because you're rooted in the communities that you serve. So your voice matters. Don't ever underestimate that. And that's why I'm delighted that you're going to be fanning out, talking, I hope, to 535 members of the House and the Senate.